Bismillah ar-Rahman Rahim, my dear vascular colleague. Here is another lesson for an online course for doctors and the vascular surgeon. Well, a lot of time you are faced with a CT scan with multiple variety. Can we get help of AI in giving us diagnosis and explaining why? There is an artificial intelligence tool which is called the CT scan by Black Polish, which is a very nice tool. I think it is of benefit. My name is Dr. Muhammad Omar Al Farouk. I'm a consultant vascular surgeon. So the lesson today is a new way to read and study CT angiogram. And this is extremely useful tool. Now let us see how we can do it. Very easy. With your mobile phone, you just go to this QR code. And when you go to this QR code, here I will show you how you can deal with it and how to get information. When you press on the QR code, you will go to this link, which is CT scan by Black Polish. And let us first upload a CT scan. So you go to upload from your computer, and then I will upload the image. Here is the image, like this one. And you can upload the image. And here you put a question. Tell me what you see in this CT scan. And then you push. It's actually very quick. It does give quite a quick reply. It doesn't take much time. So here it gives you analysis of the three axis, the axial view, the sagittal view, and the coronal view. CT scan is on the thoracic aorta, so he diagnosed the anatomy. Yellow arrow will actually indicate the area of interest, which is, we can see aortic dissection. This is type A aortic dissection, which is dilatation of the thoracic aorta. And the label D is the area of the aortic dissection, and the yellow arrow. And here is the angiogram. I will try to enlarge it a bit so we can know what he is describing. So here is the dissection, descending thoracic aorta. Here is another flap. Here is the flap on the sagittal view. And what is your diagnosis? This is a tricky bit because they always do protection. They don't want AI to give a diagnosis and then patient will blame them for this diagnosis. So you usually get this kind of, let us say, short paragraph. Actually, here it doesn't. Based on the CT finding, the most likely diagnosis is thoracic aortic aneurysm with aortic dissection. And it starts to describe the aortic dissection level, the dissection flap, and additional evidence of his argument. Here is another differential diagnosis. It can be intramural hematoma, aortic rupture, penetrating ulcer. And the next step for the immediate workup, it gives you a suggestion what you need to do. He need to see obviously the full X-ray, the clinical picture, in order to diagnose the extent of the dissection. And then he give you a bit of management as well. Urgent intervention, monitoring. This is a critical condition that require urgent intervention. And I would give it 10 out of 10, really. This is a very, very great tool that you can use. It's free of charge. It would help you. Not only it will help you, but it will teach you as well how to read CT scan. And you can ask any question as if you are speaking to consultant radiologist. And I think it's very, very useful tool to doctors, and I wish you all the best.